Welcome to the office.
How you doing?
Better than I'm here.
Welcome to the office. How can I help you? Where are you coming from?
Abbotsford, BC.
Abbotsford, BC. For those of you who don't know, it's Vancouver, just outside Vancouver.
Yeah.
What are you doing here?
Numerous years of chronic back pain. It's taken away most of my whole life.
How old are you?
26, I'll be 27 in May.
Started when?
16, and then around 20.
What happened? What happened at 16?
I don't know, that's the thing.
Like-
Just pain just started coming
Where?
on.
Where?
Upper back, where it's always been. And then around 2019, like 4 years ago, that's where it just...
Let's rewind. We got to go back to when you were 16 years old. So up until 16, and Mom is in the back over here, I will ask some questions to Mom, even though I'm looking at you. If that's okay, Mom?
Yes, it is.
All right, so I'm sure you were an active kid, you played a lot of sports.
Yeah.
Your main sport was?
Hockey.
Hockey, yeah, what position?
Winger.
Of course. Any
Yeah.
other sport besides hockey? What about in the off season?
No,
Or is there no off season of hockey?
No, it's year round for me.
You started getting into hockey or sport at what age?
Hockey was 7.
And so you're playing hockey, you're a winger,
Mm-hmm.
and you're 16 years old, and you start to feel this upper back pain. Prior to that, you had no issues?
No issues, no.
Okay. And so then 16, you woke up with it?
I just remember being at a store with her and started feeling pain, and it just gradually built up.
And you obviously saw the doctors over there, treatment, they tell you what's going on?
They gave me a very brief answer.
Which is what?
They initially told him like to start strengthening his core,
Yeah,
different things like that.
stretches.
Okay. Now that's at 16.
Yeah.
Fast forward to 2019 now.
Mm.
Tell me about 2019.
2019, that I just noticed the pain went from like painful to like just unbearable every day. Standing, sitting, nothing. Just it felt like I was run over by a bus when I woke up, went to bed, and it made working impossible. Daily chores, stuff you're supposed to do as an adult. It makes it almost impossible.
And then you start, any other conditions I need to know about?
Diabetes, I guess.
So you've seen chiros, you've seen neuros, you've seen doctors, you've been through that whole round.
Everything I could think of.
You had any result or relief with anybody?
6 months of lesser pain from a man who did, I think, the same method as you.
Okay.
It was still very painful going to work.
Okay.
I think he fixed it up like he
20,
took
30, 40%?
yeah, maybe 50 at the most.
Okay, good.
But
good.
it declined quite fast, and then I went right back to where I started.
So when that happened, did you go back to check out and make sure nothing was going on? You went back to the neuro or hospital or anything?
No, I just kind of suffered through the pain.
Okay, so we don't know if something else happened along the way.
Yeah, no.
All right. Okay.
When I saw him right after that, that's where I kind of took up, I'd say, working out a little more. And I think I might have went a little too hard at the gym, like 6 days a week, which I think was just way too much.
Probably.
So
Okay.
if I was going to do that, I'd have to cut it in half now, which I think would be the much smarter thing to do.
Okay. Well, we'll figure that out.
Yeah.
Okay. Do you know what you were getting worked on, by any chance? Sacrum, pelvis, L5.
Sacrum, pelvis, yeah. Not too good with the terms,
Okay.
but
Mom, you know anything about that?
No.
Okay, no worries. No worries. It's
Yeah.
okay. All right. So we're gonna. We took some X-rays, and we're gonna see kind of where we're at as of today, and this is our baseline. Okay.
Perfect.
And as you know in the work, we're looking at this as a 24-story building. You're complaining of the upper back, mid-back area.
Yeah.
And the way we look at it in the Gonstead work is we're looking at the foundation, right? First,
Yeah.
on your side profile, and we're going to go into more detail there.
Mhm.
We're designed to have those 60-degree reciprocating curves, and the good news is your shoulders at least do line up, even with whatever imbalance is there. Your neck lines up with your low back. So that's actually good news. Your discs are pretty good here. I'm pretty happy with your low back discs. Again, we're going to just go in more detail. I'm just giving you a general overview. But there's definitely something going on in the foundation, definitely. And why don't we start looking at that first? Now, the thing that threw me off a little bit, and the good news, the Meganblasie, or the gastric air bubble we talk about in terms of digestion, is pretty decent here. However, you still have a lot of undigested food going through there, and that's what kind of threw me off a little bit. But the Meganblasie is good. When we look at your foundation, let's take a look now. So we can see the left side is down, the right side is up. But we definitely have this bent tailbone here. You see this tailbone?
Oh, yeah.
Okay, so we have a bent tailbone starting way down here, maybe even down at the S5 coccyx. So the whole spine is the whole foundation is kind of tilting to the left side. Do you see that, Mom?
I do.
Okay, and from that what we have is this. We have this curvature that's starting because of the tilted tailbone and tilted pelvis. And then what happens around the mid-back area, it's compensating to try to bring it back to neutral. This area is trying to fuse, okay? And the term is, I don't know if they've mentioned this to you. So this is kind of trying to fuse here. This is trying to fuse here. You can see the osteophytes coming off the bone.
Oh, yeah.
Okay, so they're like hooking together. And whenever we see that, the way I explain this a lot in videos or older videos, this is the body trying to stabilize the area. So that's stiff. Okay, that's stiff. I'm not trying to break that up, but we're trying to figure out why is that there, right?
Yeah.
And I have seen many cases that the body can lay it down, the body can take it away. We want to try to get it before it fuses, though. Now, along the way, you may get pops and cracks in your body you didn't have before. That's okay, but I want to know that stuff. So part of your homework here is going to be journaling. Okay? Part of your homework.
Yeah.
All right, so let's rewind before we continue up. We're tilting on the left. Spine goes to the left, then it does what? Compensates, wants to come back to the right. Why is it doing that? We have what's called a righting reflex. And the righting reflex, we're biped predators. We have our eyes in the front. And the righting reflex states that the body will do everything and anything to maintain the head straight and the eyes level. That's where these compensations come from.
Okay.
So, you don't see people walking like this, right? You always see them kind of tilting to the side. Now, that's really important because if we can get the foundation right, then I'm hoping things will start to shift around here, okay? And if we start to get pops and crackles in areas we didn't have, that's actually a good thing in your case. Because, look, this is trying to fuse here and here. We're starting to get a little bit over here on this side, tiny bit, okay? It's this area here. You're feeling most of it up here or here?
Both spots.
Here. So if we start over here, 5, 4, 3, 2, 1, 12, 11, 10, 9. This is where the fusion is happening right here. Starting here, this whole thing is trying to fuse together. But all of this is a result of his foundation now. Okay? The way I see it. So we start to curve around here. This part of the spine, this is the area that controls digestion. But again, it curves, compensates. So all of this is compensation going from that low back, whatever that initial injury was. Okay? Now let's go a little deeper in the foundation. Let's go on the numbers, and we should start to get a few answers here. So we have a rotated sacrum on the right side. We have a drop pelvis on the left. We have a measured difference of 11 millimeters on the left side. Follow my process. This is all trauma initiated. We have 11 millimeter drop. If we are able to correct this pelvis, PI4EX5, then we can get it up to 7. But 5 of that is coming from here. This needs to be under 7 for all these adjustments to hold regardless. But what I'm showing you is 4 of this came from the pelvis, 5 of it came from the sacrum. This is trauma.
Wow.
This is trauma that started it, okay? This isn't like I just woke up and it started to hurt. This is trauma. And we have the tailbone. So here, let me put this together. Left pelvis goes down, turns out. Sacrum on the right goes back. Now, here's the interesting part. Your pelvis, your foundation wants to go to the right, but your short leg brings it left. So I know you got the habits for a wiggle. I'm pretty sure you got the wiggle when you walk. But does that make sense? So he wants to go to the right, but his short leg wants to bring him back to the left. Now the question is, what came first, the sacrum or the pelvis? I don't have that answer right now, okay? But regardless of what it is, we've got to figure out where we're going to start. Our challenge in this case is this. The rotated sacrum is on the right side. The rotated pelvis is on the left side. The tailbone is dropped down here, okay? You see, it's dropped.
Yeah.
It's level right there. It drops somewhere in here. S1, 2, 3, somewhere 4. Let's go to the lateral and see what the heck is going on there. So S1, S2, S3, S4, S5, and the coccyx. S2 is off. Starting right there. S5. Coccyx, S5. You're gonna make me work on this case, dude.
Yeah, I'm a pretty hard case.
So the deal is with the sacrum, right? It matures, it starts to mature at 25, but doesn't complete ossification until 32 to 35.
Oh, okay.
That's the good news.
Is that just for males? Or
That's everybody.
everyone? Okay.
Now, we can, here, follow my process, this is my thought process. We also have a compression fracture, old compression fracture right there. And that's probably one of the culprits right there. 5, 4, 3, 2, 1. L1 is an old compression. 12, 11, 10, 9, 8. Again, compression, compression. That's a nice compression. Your body's just trying to stabilize, brother. Okay, so this is the way I'm seeing it. Let's examine you in a second. Let's look at your upper cervical mechanism and see what's going on here. This is all compensation. But if we look at this, let's look at this real quick. Oh, this is going to be a fun case. I say that very, not funny though. I've got to be a little serious here. Oh, it's so subtle. Alright. Do-do-do-do, ch-ch, do-do-do-do, ch-ch. I hum weird tunes, Mom, okay? Don't mind me.
It's all good.
C2 right, C1 left, upper cervical. It's misleading. Alright, C2. That's if we even have to be there. It's like Jenga, dude. It's like Jenga. Alright, well, these two lines, this is the occipital line and the atlas line, they're both tilting. C2 is to the right, C1 occiput is to the left. Okay, so they're both there. So if I have to decide between that, we're looking at upper cervical. But once we get down here, this one goes this way. This one goes this way. Come on. You see what I'm doing here? I'm showing you the disc plane lines of the bones here. And just so we can get an overall appearance of what's happening. So these line up, could be starting at C3, C2, C1. So we do have something going on in the upper cervical mechanism. Okay, I got it. All right, let's get started. The main thing I want us to get out of this x-ray though is, this thing is all stiff. And so when you're trying to straighten up, it's probably very challenging.
Yeah.
And when we were doing the x-ray now, it makes sense why it was doing that. Okay, we got some stuff to do. Let's get to work.
Perfect.
And the first thing we're going to do is let's see you walk. Stand up for me, please. Let's go over there to the corner. And you're gonna walk to the corner of the room and back several times.
Okay.
And as he's doing that, we'll take a look. The first thing I'm noticing, he has a left dimple, but I don't see a right dimple. Let's walk. Okay, there's that dimple. Now it's coming out. As you're walking, tell me what's going on. Walk and talk.
This whole side's just, it's always like this. I'm always limping. And it always feels like there's a sword going through the top of my back.
Keep walking a couple more times, sir. Oh, okay.
An occasional.
What about your siblings? They're good?
They're
Do you have any
fine.
issues?
We got nothing wrong.
Got it. Have a seat over here, please.
Yeah.
All right. Let's run the meter on the back and let's see what we find. Let's feel the back first. He's warming the upper back. He's hot in the upper cervical. He's cold here, shoulder, kidneys. And you didn't do any icing right now, right?
No.
Okay. So it's interesting, he's cold here. He starts to warm up here. He's warm here. He's hot in the upper cervical. Gotta get this power on, see what's out. All right, let's start at the base of the neck. And let's see what we got. First thing we're getting is upper cervical. Can you scoot back a little bit for me?
Yeah.
He is in a bit of kyphosis, just because that probably is his relaxed position. I'm getting occiput, dude. You can actually see that swelling right there. C1 occiput, C2. Now we want to make sure we're following the contours of the spine. And at the moment, what are we seeing here, guys? We go upper cervical, left side. Stays on the left side. Keeps going. Switches a little bit. Keeps going. Doesn't stop yet. All the way down to down low. 10 points down in the basement. S4, S5. So sit up straight. I want to check something else. It looks like it's going to break. Never mind. Go whatever's relaxed. It looks like it's going to break here, but it doesn't.
Feels like it.
No, I'm talking like a needle, not
Oh.
you. Not you, dude.
Gosh.
Let's just make sure I'm... Oh, there's something right there. I take that back. Right there. That's around T12L1. Of course it is. Alright, so here's what I'm finding for today. We got pressure down low in the tailbone, S4, S5. We got it over here somewhere around 12.1. We'll check out. And we got something in the upper cervical going on there. Static palpation. Let's feel what's going on here. Static palpation. He's very red, very hyperemic, dehydrated. You drink water?
I try to.
You're gonna have a lot of changes while you're here, okay? Lifestyle changes.
Definitely.
1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12. 1 or 2?
2.
I like that it's 2. Alright, let's check down low. Back slowly towards me, please. L5, S1, S2, S3, yeah, S4, more tender at 5,
Yeah.
4,
5.
5. I don't think S5 was touched. I think you were probably getting worked on up here.
Oh, yeah.
That's tender, I know, I get
Yeah,
it.
yeah.
But that's not where it's starting.
Yeah.
It's starting down low. You feel that?
Yeah.
To the left,
Oh, yeah.
to the right.
Left's worse. Yeah.
S5. Back towards me, sir. L5, L4, L3, L2,
3.
L1, T12. Try that again. L5, L4, L3, L2, or L1.
5 was pretty sore.
5?
Yeah.
All right, we're not dealing with 5. We have S5. So before you were telling me it was L2. So if I go this way, and you have a high pain threshold, that's why I'm asking, okay?
Yeah.
I'm just asking out of all of them. It's
Yeah.
if I go this way, you feel that?
Yeah.
That one more?
Yeah, that one more.
Or that one more?
The
Top
last
one.
Yeah.
This one,
Yeah.
right?
Yeah.
One more time. This one more? Or that one more?
Other one.
This one
Yeah,
more?
this one.
Or the one above?
The other one.
L2. All right. Now let's start it from the bottom here. 5, 4,
Oh, 4.
3, 2. Again, one more time. You see, it's not following a pattern. 4, 3. This one more, or this one more?
That one.
All right, we're gonna do the penthouse in the basement. We're not dealing with that one right now. We're gonna check it afterwards.
Yeah.
Because you see what's happening, right? There's no pattern. If I go from the top down, you're telling me L2. If I go from the bottom up, you're telling me L3, sometimes L1, or L4 or L5.
Yeah.
So we know a lot of that is compensating anyway for the tailbone.
Okay.
Let's check up top. Does that make sense so far?
Yes.
Head down, please. Mm-hmm. 6, 5, 4, 3, 2.
3. Oh.
Mm-hmm. 2, 3.
3.
1. Compensating. Let's check the nodding of the head. You're okay with what I'm doing so far?
Oh,
right?
yeah. Do what you gotta do.
Well, it's not do what I gotta do, it's do what I need to do.
Yeah, that's what I'm. Yeah. That's what
Turn left, turn right. Look down, turn left. There it is. Down and left versus down and right.
Left's worse.
Down and left. Okay. Let's do some nodding of the head. Check the occiput. Let's nod. Nod. Up. Let me do it.
No.
So I'm just going to nod your head. Right side. Right there. So while the C3 is tender, C3 is in the reverse curve, and we don't normally adjust in a reverse curve. Let's see, I did a flexion extension. Yeah, it's not C3, it's occiput. Occiput doesn't open up on flexion. So here's my game plan, Tristan. S5 and occiput, as you will allow me to do so. After that, I will recheck you. After the recheck, we'll see if there's anything else we need to do for today.
Okay.
You're here for a couple weeks, I'm seeing you twice a day. Okay, at least for the first couple of days. We do what we gotta do.
Yep.
Okay.
All right? Yes. Oh, no. You gotta let it go, brother. Drop it down. No. We would have to do it over there. Let's go over here.
Yeah, right.
He ain't giving me nothing.
Yeah,
Nothing.
it's hard to relax it.
I know.
Yeah, sorry.
I know. That's all right. Okay, left hand right there, sir. Okay, relax the shoulder down, everything down, everything down. Drop best you can. Good. Good. That's a piece. Head down, please. Hands down. That's fine. Shasha! On the sides, light. Just light. Fingers on your fingers. That's it. There's a reason I told Shasha to do that. So if she puts too much pressure, his body's in defense.
Okay.
He'll react, okay? He will react. You got him?
Yeah.
That's the home run, baby. Gotcha. Nice. Thank you, Shasha. I got him sweating down here now. Body was all cold down there. Good. Okay. Wait for it, please. Come off slowly. Step away from the vehicle, sir. My hand is here. Hold my hand, please. And let's walk a little bit. Walk a little bit, sir.
It's a little easier.
A little different. Let's open up the back, please. Turn around. Oh, brother. Walk it off. Good. A little different. I'll take it.
A little more balance there, definitely.
That's fine. I know it's hard to see your son like this one. We get it. One more time and then let's rescope and see. So his whole low back was cold. Now he's sweating. So we got something. We got in there and it's set beautiful. That's fine. Hopefully you felt that too. It was a nice,
Yeah, felt good.
nice thunk. Okay, back over here. Have a seat. And you guys are staying there is a pool there. Perfect.
Yes. Yeah.
Perfect. So yeah, you're gonna be in the pool all day long.
Oh, yeah.
Good for you. Okay. Let's run the meter on the back now and see what happens. Starting at the base. Okay. I may have to go after that C3. Okay, now some stuff is coming out. There we go. T4, 10 points. Right on. T4. That cleared up the upper lumbar. Right on. Let's retest that S5, okay? I want you to feel this. Back slowly towards me, please. Come back. L5. S1. S2.
1.
S3. S4. S5. That's the one I did.
Yeah.
And we have a little more movement. I know it's tender. I know it's tender. 1, 2, 3, 4. Let's go back over there and do T4. T4. Of course it is. Little different lying down there right now.
Yeah.
What's different about it?
This feels like there's some weight off my back.
Because you're face down and this wants to go down. I'm going to be on T4 on the right side. I need you to receive, brother. Receive like that. Deep breathing. Deep breathing. Come on. Deep breathing. Deep breathing. Deep breathing. That's a piece. Next thing we're gonna do is go back in the chair. Just chiseling away, okay?
Yeah.
All the way back the best you can. Chisel away. Walk it off a few times. Talk to me. It's hurting.
Yeah.
Spicy.
Yeah. The main part's still pretty.
T4, right?
Yeah.
Is that the T4? That was the main part where I adjusted you, right?
Yeah.
Have a seat. The last thing we'll do when we're done, or clear the, first I gotta clear the spine. There you go. Neck is clear now. So all your neck stuff is coming from T4. T4 is clear for today. We're going to use the machine and start breaking up a lot of that scar tissue. You're zero now. Cool. What does that mean? I hurt. I'm hurting. It means wherever the pressure was today that we found is all clear. Now he needs to focus on his movement, breaking up scar tissue. He's definitely got some things he needs to let go of along the way. Definitely, no ands, ifs, or buts. You don't have to tell me. The best thing I'm happy about is getting that S5 today. Drop it down. That's it. Try not to help. On your back. Raise your right leg. Down. Raise your left leg. Down. Alright. Come on up. Stand up for me, please. Let's see the walk and see if anything's different in the walk. Let's walk back and forth a few times.
Yeah, that's feeling nice.
Feet are a little bit more stable.
Yeah, definitely.
Interesting.
Falling everywhere.
What's interesting, Mom? You never heard him say that? Or it's been a while?
No, just that he says he's already feeling better, more stable. That's great.
Yeah, there's still a fair amount of pain, but it's not like at 11 anymore.
Can you sit on the floor against the wall?
Yeah, I don't think so.
Okay. Well, it's going to be a good test for us.
Yeah.
Okay? This is one of the tests I do, is just sitting on the floor and trying to get up. And getting up should get easier. How about sitting and standing right here on the table? Sit and stand about 4 or 5 times. Up and down. Up and down. Up and down. Are you fatiguing?
Yeah.
Okay, stop then. So you fatigued at 4?
Yeah.
Okay. Again, it's a good test for us.
Yeah.
Okay, so we have a baseline. So he's fatiguing at just 4. All right. Come back over here, and I just want to test one more thing out. Sit back for me, please. Head down. You gotta give it, brother. You ain't giving it. Look up. There you go. Stop helping, dude. Stop helping. Drop, 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 down, down, down. Ain't gonna give. I gotta do one more thing. Come over here, face down.
Yeah.
So he's gonna need more prone adjusting because until you give it up, dude, you ain't giving it. You're fighting. You're in defense. You sure you didn't play a defensive wing?
Oh no.
Oh, you acting like you played a defensive wing.
Too offensive for defense.
Chin up, then down, into the table. There you go. Capiche. Step away from the vehicle, sir. Try one more walk.
Okay.
Cool. Cool. I'll take that one. Turn around. Squeeze the hands. Slowly,
Sorry.
slowly, dude, slowly. Relax the hands, relax the hands. Relax the hands. Relax the hands, dude. Let it go.
I'm trying.
There you go. Let it go. Drop. There you go. Let it go. Nice. 5 times. Lightly, light. When did you start to get this stuff? Pigmentation? Did they say it was vitiligo?
Yeah. It's been a few years now.
Ooh, new clinical term. So pigmentation started to 5 years? 6 years? Somewhere there?
Roughly. It could be longer. It's more.
Only here on the hands?
Some spots in the hip and that.
Squeeze slow. Squeeze slow. Okay. That's where we're going to start. We got work to do to figure this out, okay?
Definitely.
But the number one thing I'm trying to do with you is to stabilize your foundation. We can get the foundation stabilized, he has some stability, he gets more movement. Let's see what happens to the mid-back along the way. That thing is a board, but I'm chiseling away at it each time. We may have to break out the other table in the other room, and we'll get to the knee chest table hopefully by tomorrow. As long as you can handle it, okay? I'll go as much as you'll allow me to. I'm not fighting you. Cool?
Sounds like a
And
plan.
you need to receive. Welcome to the office.
Thank you very much.
You're welcome, sir. Mama, welcome to the office.
Thank you.
You're welcome.
Appreciate your help.